Well, by the time I got the treatment, I was really ill with it. I've seen a doctor privately who's had a lot of success. It's a doctor that works in Breakspear. When I saw him, I was numb from the elbows down. My legs were numb. And I've had a positive blood test as well.
Where did you get that from?
In July 2009.
Right, okay.
From Inverness.
From the NHS in Inverness?
Yeah, my doctor took another blood test and it was positive.
Right. Dr. Seaton, I mean, there are clearly, lots of issues here. I mean, I'm not a medical person, so I don't know where to lay any responsibility, but there are clearly lots of issues, aren't there? I mean, is the medical profession concerned itself in terms of the way that this is being handled and the fact that there are people out there who are very concerned about the way they're being dealt with?
I think it's fair to say that experience and knowledge in the medical profession is increasing all the time about Lyme infection, and perhaps there's been a slight lack of awareness amongst some physicians to date. Some of the symptoms that Mary's been describing, like the Bell's palsy or the facial palsy, these neurological symptoms, are certainly well described with Lyme infection and can occur later on in the illness. And she mentioned also about the blood test, which can often also be negative at the beginning of the illness and doesn't become positive until later on. So I think as medical practitioners we need to be alert to the early signs and also to these funny symptoms that can occur later on. But some of these symptoms she's describing can be specifically associated with Lyme. I would still hope that everybody out there can get the answer through the National Health Service. And as I've
clearly
said,
not, clearly not, because of the reaction that we've had. I mean, even if you were just to count up in simple numbers through text and phone calls, even if you're talking 10 people, then clearly not everyone can. Yeah,
well, perhaps that's the case, but I hope that awareness is on the increase.
Would the medical profession not be advised at this point to be taking, more direct action rather than kind of hoping that awareness is improving?
The Health Protection Scotland have on their website links towards national, European and UK guidelines, and also information on tick removal. And this is something that Mike had brought up in his phone call. He mentioned he didn't remove the tick properly that had bitten him in the northeastern seaboard of the United States. It's critical if people do get tick bites that they are removed properly. They're not just scraped off. And if you go to the Health Protection website, there is information there on the best way to remove it with tweezers, or there's a special tick removing device that you can buy from many retail outlets.
Yes, Tom in Edinburgh has sent us that very note saying that he got a tick removal implement available he got it from the internet. He checked it out before going on a journey, so Tom's obviously very organised. I mean, Richard, I'm kind of struggling just to get a sense of scale and scope of all of this. I mean, of the people that you spoke to, is there a genuine level of dissatisfaction with the medical community in the way that they're treating Lyme disease, or is there an acceptance that perhaps awareness needs to be improved a bit? And
there clearly is a level of dissatisfaction, but you do have to put it in perspective. And one of the things that we've got to be aware of is that people shouldn't panic over Lyme disease. If you get a tick, if you get it off in 24 hours, you're not going to get the basic Lyme disease, and you're not going to get the complications and the symptoms afterwards. Having said that,
for the individuals who are affected,
it is devastating. And there are a group of people out there who are very badly affected by it, and who are having a hard time, and who are baffled by it. And part of the problem here is, I think part of the problem that I can see is that people expect doctors to have the answers. People do expect these days that medical science will have the answers. You get ill and you go along to the doctor, and they'll tell you what it is.
But they should also expect them to recognise there's a problem.
Well,
and
yes.
With all due respect, Dr. Seaton, I'm not getting that great sense from you.
Well, I can't speak for every single medical practitioner.
No, but even speaking for yourself, do you think there's a problem?
Speaking for myself, well, I think one likes to think that one will listen to patients' problems, will put them into... Obviously, when a doctor is listening to a patient, they're trying to think of a wide differential diagnosis. They're trying to think of what could be wrong with the patient, and it may not. Sometimes the doctor's view may not concur with the thoughts of the patient.
What are we saying here? I mean, is it your belief that in many instances people who believe they have the ongoing symptoms of Lyme disease actually have something else?
Well, I think sometimes they may. Sometimes they may not. I think we should be doing more testing. So if patients believe they may have Lyme disease, I think it's absolutely reasonable for a doctor to do a test and to listen in an open way and a compassionate way to what their patient is saying. Okay. But certainly do more testing. Can I just mention again about the tick removal? Your earlier caller, Mike, had been bitten by a tick in America, where the rate of Lyme disease is much, much higher. The rates in this country are much lower. In fact, the highest, if there have been studies that have looked at the rate of infection of ticks around Scotland, and they're all less than 10%. So if you get bitten by a tick, there's a less than 1 in 10 chance that tick will actually be carrying the Lyme bacterium.
Okay. Well, we want to talk about what's happening in America in a wider sense. And also, Richard, I'm interested to know what the Lyme Disease Action Campaign Group is looking for here. But let's speak to Rodney in Aberdeen. Morning, Rodney.
Oh, hello, Kate.
Hi. What's your experience of this disease that I was ignorant of until, Friday, and now I'm intrigued by?
Yes, indeed. Well, I got bitten by a tick in 1984.
1984. Wow.
Yes, right. I for 10 years I had odd, rather curious neurological symptoms. It didn't stop my activity. It didn't stop me working.
What sort of thing, Rodney? Just to give us a picture.
The symptoms. Well, I had problems with my knees.
Right.
And I had problems with pain in the shins, in the shin bones, and 10 years later, in 1994, I got badly scratched by a cat, and that, I believe, has given me Bartonella, which is recognized as a co-infection of Lyme, and I'd very much like to raise this point because UK are the only person who's picked up on the fact that Lyme disease is not just about one infection. It can be about several, and I think this is the problem that the medical profession have, is that they struggle to cope with the fact that when patients talk about Lyme, it's a generic term, and when doctors talk about Lyme, they're talking about Borrelia or Dorferi or the various species of Lyme, and there you have a divergence, and so they send blood off to be tested just for Lyme, when in fact what the patient needs is for the possibility of co-infections to be considered. So blood gets sent off. For most of Scotland, it gets sent to Inverness, but for some bizarre reason, my blood, and I'm in Grampian region in Aberdeen, my blood is sent down to Southampton.
Right.
So I'd very much like to know why the serological testing isn't uniform. Why isn't every doctor in Scotland singing from the same hymn sheet?
Okay. Let's ask Dr. Seaton then, Rodney. Can you help Rodney with this?
Morning, Rodney. I think the point you made is an important one. A doctor has to understand what a patient is saying. You have to be on the same page. And if your perception of Lyme disease is different from that of your doctor, that really needs to be ironed out in the consultation. So I completely agree with you. I suppose the medical professions, when we talk about Lyme borreliosis or Lyme disease, we are talking about infection with the Lyme bacterium, the spirochete.